Good evening and welcome everybody. This is Nurse Eunice with Florida Train Academy, and in today's video we're going to be discussing the herpes outbreak. What should you be doing as a CNA to care for a patient if they have an outbreak of herpes? And as we do in each of our videos, we will give you a few moments to receive your notifications and we will get started shortly. Also, I will not be monitoring the comments until we get to the practice test, so just hold tight, and that's when I'll review your comments and congratulate all of our new CNAs on passing their examinations. Okay, so let's talk about herpes. The introduction to herpes. Herpes is a common viral infection caused by the herpes simplex virus, or HSV. There are two main types. We have HSV1, which often causes oral herpes or cold sores, and we also have HSV2, which usually causes genital herpes. Herpes can affect people of all ages and is spread in specific ways. Knowing about herpes can help CNAs provide safe and compassionate care to patients. So, there are different routes of transmission. One of the first routes we will discuss is direct skin to skin contact. Touching herpes sores, blisters, or affected skin is one way in which the virus can be transmitted to another person. Another route of transmission is going to be saliva or respiratory droplets. So, herpes simplex virus 1 or HSV1 can spread through kissing or sharing items like utensils. This image may be a little graphic, but it can also be spread through sexual contact, and that would be your herpes simplex virus 2. It's commonly spread through vaginal, anal, and/or oral sex, and the image shows what it would have looked like if you saw this on one of your patients. An additional route of transmission would be mother to child during birth. So, if the mother has an active infection during delivery, she can spread the herpes to her infant. So, herpes is not spread, however, through casual contact, such as hugging or sharing a bathroom. What are the signs and symptoms? So, HSV1 or oral herpes, we would have painful blisters or sores around the patient's mouth. Sometimes before the blister or the sore erupts, the patient may complain of a tingling or an itching sensation on the mouth. For genital herpes or HSV2, the blisters or sores are on the genitals, the buttocks, or the thighs. Another complaint that a patient may have would be pain during urination or genital discomfort. I chose this image to represent a patient who was probably immunocompromised, maybe due to cancer or HIV. But other symptoms of herpes could be fever, body aches, swollen lymph nodes that may break out during the outbreaks. But there are some people who may have no symptoms at all but can still spread the virus. The virus won't actually come out, or you won't start seeing the blisters until the patient is stressed or until they are sick. So be very careful if you're taking care of somebody who is more likely to contract infections, because you could definitely take this virus from one patient to another if you're not properly washing your hands. Let's talk about shingles. So we talked about HSV1, which was the cold sores, HSV2, which was genital herpes, but herpes zoster, also called shingles, is a painful skin rash caused by the chickenpox virus or varicella zoster virus. After a person has chickenpox, the virus stays in their body and can become active again later in life, thus causing shingles, as the image demonstrates there. It often shows up as a band of blisters on one side of the body or face. It can be very painful and contagious if the blisters are open. Why wear a mask for herpes zoster? So, we're going to talk about when PPE is required But specifically, if your patient has shingles, a diagnosis of shingles, shingles can be spread through the air. Thus, you're going to be required to not only have on your gown, your gloves, you're going to have to wear a mask also, because the virus can be passed to someone who's never had chickenpox or the chickenpox vaccine, and it could cause them to get the chickenpox. And so you're going to easily contract this virus if it's spread through the air, especially if you've not been immunized or if you've never had chickenpox. That's why CNAs may need to wear a mask to protect themselves or others from breathing the virus in the air. In our next slide, let's talk about the preventative measures. First, of course, is hand hygiene. You're going to wash your hands frequently, especially after touching a patient or handling contaminated items. Of course, you're going to wear gloves. Always wear gloves when caring for a patient with sores or lesions, even if you don't know the reason or the cause. Put on those gloves. Third, avoid direct contact with sores. You can use barrier protection like gloves and gowns, especially if you're bathing someone. If you're bathing someone and they have skin lesions, put a gown on. And if they ask why, just say that you want to protect them because you have some sick patients. But make sure that you protect yourself in the process. Using a proper PPE. So if it's Herpes Simplex Virus 1 or Herpes Simplex Virus 2, hand hygiene and gloves. But if it's herpes zoster, don't forget that you're going to have to gown up and also wear a mask. Let's say that you're the CNA who works in a group home or some type of home health environment where the nurse may not be there. You're sometimes going to be responsible for giving advice to adolescents. Of course, you would not do this without the nurse being made aware, but you're going to encourage your patients, if the nurse has already given this information, to abstain from sex, to reduce the virus, the spread of the virus, and to encourage the patients to use the condoms. Remember, a CNA can work anywhere a nurse works. So just don't think hospital. It can be home care, it can be group home, it can be assisted living facility, and yes, your elderly patients still have sex. Another preventative measure is going to be 6, avoiding sharing personal items. So they should not share utensils, any lymph ointments, or razors if someone has herpes. And then patient education. You're going to teach your patients about triggers for outbreaks like stress or illness and encourage them to perform hand hygiene regularly. As a CNA, when you go into the room and you see a patient who has a herpes outbreak and they've touched their lip and now they're touching everything around their table, they're touching the call bell, they're touching the side rail, you want to remind them to use to wash their hands. You're going to provide them with whatever they need to keep their hands clean. So that is going to be part of your responsibility as a CNA or a patient care tech. Let's discuss the rest of your roles. You're going to provide comfort. You're going to help patients manage pain or discomfort during their outbreaks. And of course, you don't give medications. So in our test that we'll be taking in a few moments, we'll see if you can identify some non-pharmacological ways to help reduce pain. You're going to maintain confidentiality. You're going to respect the patient's privacy and avoid discussing their condition with others. If they're not directly involved in the patient's care, they should not know about the patient's medical conditions. The third way that you're going to participate in this patient's care is you're going to monitor for symptoms. I'm the nurse. I may not know that the patient has a lesion on their labia or their vaginal lip. But if you're given a bath and you see the lesion, you're going to actually notify me once the bath is done. So you're going to report any signs of infection or worsening symptoms to the nurse. Of course, you can't stop the bath immediately. Finish your bath and then make your nurse be made aware. Don't forget the patient education. You're going to provide clear and simple instructions on prevention and self-care and make those hand wipes, the hand sanitizer, and hand hygiene stations easily accessible. Before we get to our practice test, let's talk about some key takeaways. Let's review. HSV-1 and HSV-2 are spread through direct contact. One would cause a lesion or a blister to appear on the lip. and the other would cause the lesions to be on the genitals, the buttocks, or the thighs. Meanwhile, herpes zoster is caused by the same virus that causes chickenpox, which is the varicella zoster virus, and that can be spread via the air, which means that you, as the CNA, will also have to wear a mask. Make sure you practice good hand hygiene and use the proper PPE. As a CNA, you play a critical role in educating and caring for your patients with herpes. Remember, prevention and understanding are key to controlling the spread of herpes and supporting patients effectively. And now that we did our brief review, let's go ahead and go to our practice test. All right, and now I'm going to be able to view the comments, so just give me one moment. All right, question number 1, team. What is the most common cause of oral herpes? Is it HSV1, HSV2, HPV, or HIV? And now I'll reveal the answer in 3, 2, and yes. If you said A, you have the correct response. So HSV1 is the primary cause of oral herpes characterized by cold sores around the mouth. Question 2. How is genital herpes most commonly transmitted? Is it A, sharing utensils, B, sexual contact, C, coughing or sneezing, or D, using public restrooms? Yep, and I knew you would get that one correct. So great job, team. The correct response is B. Yes, genital herpes is primarily transmitted through sexual contact. Question 3. Which of the following is not a route of herpes transmission? Is it A, kissing, B, sexual contact, C, sharing personal items, or D, casual touch like hugging? Which is not a route of herpes transmission? And I am so proud of you all. You all have the correct answer. So revealing the answers in 3, 2, and if you chose D, you are absolutely correct. So herpes is not spread through casual touching like hugging. And then just as a side note, humans cannot pass herpes to dogs, and dogs cannot pass their type of herpes to humans. So, of course, we probably shouldn't still be kissing animals in the mouth if there's an active outbreak, but you can hug and love on your animal. Question 4. A patient with an active herpes outbreak in the mouth reports pain when eating. Which of the following foods is best to offer this patient? Would it be A, tomato soup and orange juice, B, crackers and peanut butter, C, applesauce and yogurt, or D, hot chili and soda? All right, I'll give you a couple of more seconds. And we'll give you 5 seconds on this one, so revealing the correct response. In 4, 3, 2, and yes, you are correct. It is C, applesauce and yogurt. So we're going to focus on a soft, bland, and cool diet. So things like applesauce and yogurts are gentle on oral sores and reduce irritation. Acidic foods like tomatoes and citrus and spicy items can cause pain and worsen inflammation. Crackers and peanut butter can stick to the mouth and be hard to swallow, while chili and soda are spicy and acidic, and both should be avoided. Great job, team. Question 5. What is the primary purpose of wearing gloves when caring for a patient with herpes? And I know 100% of you all are going to get this answer correct. Is it A, to keep the hands warm, B, to protect the patient's skin, C, to reduce allergic reactions, or D, to prevent the spread of infection? Perfect. Great job. The answer is D. Gloves prevent the spread of infection by providing a barrier against direct contact with sores. Question 6. Which of the following is true regarding the risk of scarring after an oral herpes outbreak? A, scarring is common and usually permanent. B, scarring only occurs if the patient is taking antiviral medication. C, most outbreaks heal without permanent scarring. Or D, the patient must scrub the lesions daily to prevent scarring. And I see a lot of correct responses coming through. So revealing the answer in 3, 2, and yes, it is. I think that should be C. I do apologize if there was a mistake there. So the answer should be C. Oral herpes lesions or cold sores typically heal within 7 to 10 days and usually do not leave permanent scars unless the patient picks at the lesions or has repeated severe outbreaks. Question 7. What type of herpes is most likely to be transmitted during childbirth? Think about it. Would that be HSV1, HSV2, HPV, or HIV? And of those 4 conditions, we've only discussed 2. So which do you think would most likely be transmitted during childbirth? And yes, I am so proud of you. If you chose B, you are absolutely correct. So herpes simplex virus 2 can be transmitted from mother to child during delivery, especially if the mother has an active herpes outbreak. Question 8. Why is patient education important for preventing herpes outbreaks? Is it A, to make the patients afraid of the virus? B, to promote antiviral medication use? C, to encourage self-care and prevention? Or D, to reduce healthcare cost? So the nurse provides the education and you reinforce what the nurse has said. So you can reinforce the education. Why are we educating our patients? And revealing the correct response in 3, 2, and you have it correct, Vanessa and Hilda and Tori and Sophia and Raina. You are correct. Education empowers patients to prevent and manage outbreaks effectively. Remember, when they leave your hospital, when they leave your nursing home, when they leave your group home, this virus will remain dormant in their body for a lifetime. So if they were to have another outbreak, we need to be teaching them how to manage the outbreaks and also how to prevent them. Question number 9. Which of the following items should not be shared to prevent HSV1 transmission? Would it be towels, lip balm, utensils, or all of the above? Which should not be shared? And we're torn on this one. You all are all over the place on this one. Give you a few more seconds. Revealing the answer in 3, 2, and it is D. Think about it. People use towels on their face. Lip balm is used to put moisturizer on the lips. Utensils touch the mouth. So the answer is D. Avoid sharing personal items, such as the ones we just discussed, to prevent the spread of the herpes transmission. Question 10. How should CNAs report new or worsening herpes symptoms? Is it A, call the patient's family? B, report to the supervising nurse? C, ignore the symptoms? Or D, search for treatments online? Yeah, and you got it right. We are going to be reporting our concerns to the nurse. So the response is B. CNA should report any new or worsening symptoms to the nurse. Don't assume the nurse is aware. You let the nurse know, and then that way the nurse can provide the follow-up treatment if needed. Question 10. When providing mouth care to a patient with an active oral herpes outbreak, the CNA should A. Use alcohol-based mouthwash to clean the sores. B. Encourage the patient to brush vigorously to remove crust. C. Avoid mouth care until the outbreak resolves. Or D. Gently clean the mouth with a soft toothbrush or swab. Perfect, team. You are correct. It is D. So even though they have an active outbreak, mouth care is still important, but it must be done gently to avoid further irritation or injury. A soft toothbrush or moistened swab helps to maintain hygiene without aggravating the sores. We're not going to use an alcohol-based mouthwash or vigorous brushing because that can cause damage and or pain. Question 12. A CNA notices a patient under stress due to family issues. What should the CNA understand about stress and herpes outbreaks? A. Stress has no impact on outbreaks. B. Stress can trigger outbreaks. C. Stress cures the virus. Or D. Stress prevents further outbreaks. What do you think, team? Your patient has financial issues, they have family issues, and they may have come in with an entirely different diagnosis. They may have come in because their blood sugars weren't regulated. They have diabetes. But if they are stressed, they can also end up having a herpes outbreak while they're in your care. So the answer is B. Stress can weaken the immune system and trigger a herpes outbreak. Question 13. A patient asks if they can use a shared razor in the facility. Remember, sometimes you're not in the hospital. You can be in a group home. What is the appropriate response? A. Allow it for convenience. B. Suggest sanitizing the razor. C. Prohibit sharing personal items. Or D. Report it to the nurse. There are two brothers who were in a facility together and they are just used to sharing things. What is going to be your response as the CNA at that facility? And if you chose C, like almost each of you did, you are absolutely correct. Sharing personal items can increase the risk of transmission and therefore it would not be prohibited. Question 14. A patient expresses embarrassment about their herpes diagnosis. How should the CNA respond? A. That's not a big deal. B. Everyone has something to deal with. C. I'm here to help and ensure you're comfortable. Or D. You should talk to your family about it. Whenever a CNA is communicating, the focus of active communication is active listening. So the CNA says less and allows the patient to speak more. So the correct response is going to be C. Yes, that was the most empathetic response. Providing emotional support and ensuring confidentiality fosters trust and comfort. You're not going to tell them to go talk to their family about it because maybe their family relationship is strained. You're the person who's there. Allow that patient time to speak with you. Let them know that you are there to listen. Question 15. A CNA is caring for a patient with active genital herpes lesions. What is the first action the CNA should take? A. Apply an antiviral cream. B. Avoid touching the patient altogether. C. Wear gloves and follow standard precautions. Or D. Ask another CNA to provide care. And you all are amazing. The answer is C. Wearing gloves and following standard precautions prevents infection transmission. And it's really it's sad to see when a patient gets really sick that they will have an herpes outbreak and their lip could be crusted over. And I know they're embarrassed. So the way that you handle this situation as a caregiver, it can be, really beneficial to your patient if you just let them know you're there for them. And yes, you're gowned up, you're gloved up, but you're not going to isolate them and leave them in the room by themselves. So you're still going to provide care. You're just going to wear the appropriate PPE. Question 16. A patient inquires about triggers for herpes outbreak. Which of the following is not a trigger? Stress, illness, sunlight exposure, or hydration? Which of those is not a trigger? Which would most likely not cause a herpes outbreak? And yes, caregivers, yes, team, if you chose D, you are absolutely correct. So, hydration does not trigger herpes outbreak, but being outside in direct sunlight when you have that tingling feeling, you feel like a lesion's about to form on your lip, or some of the other ones, the stress, being stressed is going to cause a herpes outbreak. And then also illness, if they become sick and their immune system decreases, that can cause a herpes outbreak also, but hydration usually does not. Question 17. A CNA observes a patient cleaning their sores with bare hands. What should the CNA do? A, report the behavior to the nurse. B, provide gloves and explain proper hygiene. C, ignore it. Or D, clean the sores for them. What do you think, team? Process of elimination. You can pretty much narrow it down to one of two, at least two of four. And so, which one is the best to encourage this patient to take care of their illness, their condition? And if you chose B, you have it. Yes, you're going to put on those gloves, give them a washcloth, and show them how to clean their lip, which would be separate from the rest of their face. So you're not going to allow them to use one washcloth for their entire face when they have a herpes outbreak. They need multiple washcloths, one for their eyes, one for their face, and one for their lips. So keep that in mind. They're going to need more cloths if they have an active outbreak. Question 18. A patient asks if they can kiss their partner during an outbreak. What should the CNA advise? A, it's okay as long as it's brief. B, only if the sores are covered. C, use a tissue as a barrier. Or D, you should avoid kissing to prevent transmission. And my fingers are crossed on this one. You're in home care and the husband wants to kiss his wife goodnight. You're the CNA there. What are you going to tell this husband? Revealing the answer in 3, 2, and yes, it is D. All right, Mr. Thomas, I know you want to kiss your wife goodnight, but right now you have an active lesion, so let's just tell her goodnight without kissing, because kissing can cause the virus to spread to the wife. Question 19. A CNA suspects a coworker is not following infection control measures with a herpes patient. What should the CNA do? Is it A, confront the coworker immediately? B, report concerns to a supervisor? C, ignore the situation? D, handle the patient care themselves? Right, so for this scenario, I want you to think of that CNA who's been a CNA for a long time. And she's like, oh, this is how I always do it. I'm not going to switch this up. I'm not putting on gloves. I always take care of her. And so, what do you think the best response is? Are you going to confront her? First of all, the word confront sounds like you're about to argue over patient care, and we're never going to do that. So, if you chose A, give me a different answer. All right, revealing the answer in three, two, and yes. Speak to your nurse about it. Don't become confrontational with your coworker. Let the nurse handle that. And so, if you told me something like that, I would just stand outside the room or nearby the room while that CNA was in there providing care. And as soon as she came out with grubby hands, I would remind her that she needs to wash her hands before she leaves the room, and that whenever she enters the room, she has to make sure she washes her hands and puts on gloves. So that kind of leaves you out of it and lets the nurse take care of that particular coworker. Question 20. Why is healthy eating important for patients with cold sores? A, certain foods can help or hurt the healing process. B, cold sores go away faster if the patient eats fast food. C, food does not affect cold sores at all. Or D, patients should only drink water during outbreaks. Well, this one is easy, but the next ones should be our scenarios, and they're going to require you to think a little bit more. Revealing the answer in three, two, and yes, it is A. Some foods like nuts and chocolates may make cold sores worse. Other foods like yogurts and fruits, as long as it's not acidic, can help the body fight the virus and heal faster. All right, and so now before we go to our scenario, I do like to just add that a lot of students will focus on questions that are going to help them pass their CNA test. And they will ask, Eunice, why are you teaching us about herpes? Are these questions going to be on my test? After you pass your test, everybody, you're taking care of real patients who are really sick, who have real herpes outbreaks. And I need for you to know what to do, how to keep yourself safe, how to prevent yourself from contracting this virus when you're out there taking care of other patients. So, with all of our videos, even though we have thousands of questions, our job is not only to help you pass this test, it's also to help you be safer caregiver. So keep that in mind as we go through our next questions. All right, so here's our scenario, team. Maria is a certified nursing assistant working the afternoon shift. She checks on a new patient who has a history of HSV2 and a current outbreak with open sores around the genitals. The patient also has a cup of water and is resting in bed. Maria adjusts the bed rails and helps move the patient's cup without wearing gloves. A few minutes later, without thinking, she scratches her lip while charting at the nurse's station. Later, she wonders, could I have gotten the herpes virus on my lip by touching the things in the patient's room and then touching my face? What do you all think, team? I want to see your answers in the chat area. You can put them in the comment area. If you touch the side rail and a patient has an active herpes outbreak, or if you touch a cup and they have herpes simplex virus 2, is it a possibility that you can spread that to your lip? And of course, we have to teach Maria to wear gloves and to wash her hands. All right, revealing the correct response in three, two, and oh, so many good responses. All right. You all, maybe, but it's not likely unless the virus was on the surface and Maria had a cut on her lip. So HSV2 is mostly spread through direct contact. That's the one that's spread by sex, with infected skin or fluids, not from touching objects. However, if Maria had touched a fresh sore or contaminated fluids and then touched her own mouth, eyes, or broken skin, there is a small risk of the virus entering her body. Either way, don't be a Maria. Make sure you wash your hands and put on gloves. All right, our next scenario, team. Oh, let's finish reading this one. Oh, this is our new scenario. I apologize. So this is a different Maria. Maria, a CNA, is assigned to bathe a new patient. While assisting with undressing, the patient says, "My back is really sore, and I think I have some kind of rash or blisters back there again. It feels like the shingles I had before." I hope none of you all is named Maria because I'm really working you today. All right, so this poor Maria. Maria looks and notices a cluster of red blister like bumps on one side of the patient's back. The area looks painful and possibly infected. Maria suddenly remembers she's never had chickenpox and has not received the chickenpox vaccine. What should Maria do? So, this patient has admitted to having shingles previously, and it feels as if she has shingles again. Maria is in there to give a bath. What should she do, everybody? All right, I'll give you a few seconds to enter your responses in the chat area. And whether you're wrong or right, it doesn't matter. It's just getting you to think about this because in a few weeks, this could happen to you for real. What do you do? All right. So, as a CNA and as a nurse, we don't diagnose. So, you would, of course, notify the nurse. I would go in, I would assess, I would notify the doctor. But as of right now, it's just suspected. So, Maria is not allowed to diagnose the patient with shingles, but she must protect herself and follow proper protocols and procedures. So, at a minimum, she should one, stop the bath immediately and notify the nurse right away. Two, avoid touching the blisters or continuing care without proper PPE. And then three, since she has no immunity to chickenpox, she may be at risk of getting infected. So she may not be the best CNA to be assigned to that patient. Even though it is not confirmed, it is suspected. That is something that Maria has to keep in mind. Something else that the nurse is going to ask you to put on the door is an airborne precaution sign. So if someone has herpes zoster or shingles, whenever we enter the room, we have to have our N95 mask. So not just a regular mask, we have to have the thicker mask. We're going to have on gloves and we're going to have a gown. And so, our key reminders for CNAs: if you've never had chickenpox or the vaccine, you should not care for patients with active shingles unless cleared by a supervisor and properly protected because your safety matters too. And as we do with all of our videos at the end, I just want to remind you that great CNAs and patient care techs become great nurses. So I'm so happy that you're starting off the right way. You're just not going straight into nursing school. You're learning about the field first. You're getting your hands on. You're learning those bedside skills. You're learning communication. You're learning how to work with others. And then that way, once you go from CNA to nurse, you're going to be awesome. So everybody, I know this was a different video, but I wanted to discuss it because we had a patient a few weeks ago who had a herpes outbreak and the caregiver did not know what to do. So we want to make sure that you, our viewers, know what to do as CNAs until that nurse can get into the room. So as we do in all of our videos, I want to say that I love you and that I will be back on this week with a video focused on CNA questions. I know that's what you all really enjoy, but I hope that you're also enjoying Nurse Jackie, and I will be back on here on Thursday. So thank you all for watching, everybody. And if you haven't done so, like the video, subscribe to our channel, and I'll see you later this week. It'll be at the same time. Bye.